The pandemic found a very poorly funded and ailing healthcare system with a very lean workforce. Now, the almost total focus on COVID-19 in the initial stages of the response led to the neglect of regular health services. So clinics did not run, outreach services stopped, immunizations were skipped, and in many instances, hospitals were suspending some services in order to make room for the COVID-19 units.
The COVID pandemic, the way I presented it, has exposed so vividly and so rapidly so many of the deficiencies that we carry in our health systems, and particularly how overburdening are our healthcare workers.
In a recent survey from WHO, we could see that more or less 50% of the services were disrupted for people living with non-communicable diseases. As the pandemic progressed, of course, we could see that there was a progressing extent of disruption, and in the most affected areas with community-based pandemic, we could see up to between 50 and 60% of the services disrupted.
In the community level, we found that regular NCD screening program had been stopped almost 3 months. As a result, many high-risk individuals, who mostly older people and women, were unable to get their essential medications.
From the onset of the COVID-19, people living with non-communicable diseases, meaning diabetes, cardiovascular diseases, lung and heart diseases, are much more vulnerable to becoming severely ill and also dying from COVID-19.
The COVID-19 fatality rates in young adults in Mexico and Latin America are much higher than those observed in other areas such as Europe. This is the result of the high prevalences of obesity and non-communicable diseases in young adults in Latin America.
The coronavirus intersects with another really important global public health issue, which is obesity. It's rising all over the world, and it's an important concern in and of itself. And now it's an even more important concern because it's been shown to increase the risk of complications from the coronavirus.
The COVID-19 pandemic has had a colossal impact on the economy of the region and the country, exposing the most vulnerable risk group to a situation of insecurity and inequity. This impact has exposed the social difference there is regarding access to adequate food and housing and other basic needs. People in a situation of vulnerability also represent a large percentage of risk groups with worse health prognosis in case of illness from COVID-19.
Stress is a key factor in exacerbating NCDs is well known, and chronic poverty is a major stressor. Already in India, data tells us that in urban areas, the lower quintiles are the ones who have higher prevalence of hypertension and diabetes particularly. And therefore, it will be this group that will take much longer to recover from the impact of the pandemic.
I think that we're seeing the widening of existing health inequalities, as well as the intersection of social and cultural determinants of health with COVID-19. So this includes things like economic disadvantage, issues with housing and people's physical environment, access to food and water, stable employment, and then also cultural determinants such as the disruption to people's connections with their community or traditional practices, or even access to healthcare that's free from racism. And with these exacerbated inequalities, we're seeing that it's often Indigenous peoples worldwide that are most affected during this public health emergency.
Until COVID-19 came along, the international community, for example, rarely was speaking about NCDs, about multimorbidity, about aging within the context of pandemic preparedness, within the context of health security, as well as health emergencies. That must all change going forward. The crisis should really be seen as an accelerator to help break down these very established silos within global health.
We have an opportunity. And the opportunity really is the recognition that public health is important, that the money spent on prevention and the effort put into prevention really works.
There is a major gap in the evidence, in research and in policy responses to multi-morbidity, which COVID-19 has brought to the fore as a real priority for global health. The exact extent of the problem and the rate at which it's growing is still really poorly understood worldwide.
Because of travel and physical distancing restrictions, many activities that were carried out by healthcare workers face-to-face are currently being delivered using telephone or other media solutions. And I think it's probably there's a strong need to determine just how effective this is. Also, for those who are living with chronic conditions, where there's a need for regular and ongoing access to medication, we need the evidence around alternative solutions where people just can't get to clinics or pharmacies to obtain their medication.
Research focusing to find innovative ways for ensuring most vulnerable people to access essential health services. For example, research to develop an innovative telemedicine to replace in-person medical consultations will be benefit for vulnerable people in rural areas.
I believe research needs to ensure rapid community engagement assessment to collect data from it and allow better targeted actions and activities for vulnerable populations such as NCD social collectives.
Public engagement helps to build trust. It also widens the ambit of accountability. Public communication and public advocacy in a language and form that people of different sections of society can understand is important across countries, certainly very important in a country like India where there are huge information asymmetries.
We need to conduct more research that considers things through an equity lens and considers the social and cultural determinants on people's ability to access healthcare and to really live a healthy life. We need more research that recognises the strength and resilience of communities that are often underserved or undervalued.
As we see, the pandemic is exacerbating them through disrupting food consumption, level of physical activity, and also level of their mental health.
Preventing the development of the likelihood of chronic conditions in the first place would be a great step in resilience. But looking more pragmatically at resilience, we need a spectrum of research that's both biomedical, social, cultural, behavioural, to understand how to support those who are actively trying to manage their own health and well-being through physical exercise, through their diet, through reducing their alcohol intake. And we need evidence on how to maintain positive mental health.
The coronavirus raises a really important challenge for the world today, a really important question. How can the world develop and sustain an economy that supports people's livelihoods and that provides the goods and services that we need, while also supporting their health?
We need to have answers to what kind of lockdowns are not just effective in stopping the virus, but also in allowing people to survive. Were we to have another lockdown, what shape, what form should it take?
There are many issues that come to attention. For example, crowding and overcrowding in big cities and transport, which calls for how we plan our cities better and how we organize our cities better. Food supplies, food systems, how do we depend on multiple layers of connection for having a healthy behavior and lifestyle.
We're also seeing the emerging evidence on COVID and on previous similar diseases that shows that there's a range of social and demographic factors at play, and that's age, race, ethnicity, class, that are intersecting with gender to explain the differential risk of disease and death due to COVID. And understanding how these factors interact is really essential to then better targeting research and tailoring public health approaches.
There was perhaps never a time when doing research was actually more challenging. But actually, doing research is incredibly important to provide us with that much needed evidence on how we will tackle the next pandemic more effectively and more quickly.
I am really hopeful that the coronavirus pandemic, as awful as it has been, will have some silver linings. And one of those is that non-communicable diseases will be taken more seriously by the global community. And that will mean we're more likely to achieve target 3.4 of the Sustainable Development Goals.